Lower GI bleeding. It can be very scary to see blood in the toilet or when you wipe after a bowel movement. Fortunately, most of the causes of rectal bleeding are not life-threatening. Common causes include hemorrhoids and anal fissures. So what causes blood in the stool? Common, benign, non-serious causes include hemorrhoids, which are swollen blood vessels in the rectum or anus that can be painful, itchy, and sometimes bleed. People with hemorrhoids often have painless rectal bleeding. Bright red blood may coat the stool after bowel movement. It also might drip into the toilet or stain the toilet paper. Anal fissures is a tear in the lining of the anus. Anal fissures can cause bleeding and a sensation of tearing, ripping, or burning pain during or after a bowel movement. While most rectal bleeding is caused by the non-serious causes, it can also be caused by cancerous or precancerous conditions. Precancerous polyps near the end of the colon, large intestine, can mimic bleeding from hemorrhoids. These polyps are generally present in the colon for years before they become cancerous, and they can be removed very safely from the colon, preventing progression to cancer. Colorectal cancer is sometimes diagnosed in people who have ignored bleeding for years because they assumed it was from something benign like hemorrhoids. This is why anyone with rectal bleeding should consult a healthcare provider to determine the cause. If colorectal cancer is diagnosed early, it can often be treated. The risk of polyps and colon cancer increases with age. This is why screening tests are usually recommended beginning at the age 45 or earlier for people with certain additional risk factors. There are other causes of rectal bleeding as well. This includes colitis, which is inflammation of the colon, proctitis, inflammation of the rectum, diverticular disease, angioectasia, which is abnormal blood vessels in the GI tract. Bleeding from higher in the digestive tract, such as the stomach, can cause black, tarry-looking bowel movements. This is because the stomach acid turns blood black. In other cases, however, upper GI bleeding appears bright red in color. How do we diagnose blood in the stool? So we can learn a lot more by just asking questions about your bleeding, so including the frequency, amount, and appearance, your bowel habits, whether you have other symptoms, such as pain, and your family history. For example, if you have relatives who have been diagnosed with colorectal cancer or other cancers. Sometimes we can determine the cause of your rectal bleeding with a rectal examination. This typically involves inspecting the outside of the anus and inserting a gloved finger into the rectum to feel for any lumps or other abnormalities. An anoscopy may be done at the same time. During an anoscopy, the clinician uses a rigid tube to inspect the anal canal and lower rectum. This can be done in the office and does not require sedation. Now, to rule out serious causes, a colonoscopy is performed by inserting a device called the colonoscope into the anus and advancing through the entire colon.